EPS was established 25 years ago with the main objective of caring for children in this country and beyond. And during these 25 years, we have been involved in many activities together with the Federal Ministry of Health and the developmental partners working in the country who are engaged in child health.
Ethiopian Pediatric Society is a society of pediatricians who have dedicated their lives to the cause of children.
So Ethiopian Pediatric Society, as far as I know, is a society organized by pediatricians, senior pediatricians, subspecialists, and I've also heard some pediatric residents for the sharing of knowledge and helping children all over the country.
Ethiopian Pediatric Society is one of, I would say, the oldest society that really stands for the health of children in this country, and we had really gone so far in discussing health issues pertinent to children with the Ministry of Health and including international donors, so that children need to be really well taken care of as far as their health is concerned.
The Ethiopian Pediatric Society is one of professional society which is dedicated to improve as a whole pediatric as well as child health.
Well, Ethiopian Pediatric Society is it's an association which is mainly focusing on the well-being of children. As any professional society, that's what it's trying to do. And now it is almost 25 years since its establishment, and it's growing as any child is growing.
Ethiopian Pediatric Society, it's a professional society where it brings pediatricians in Ethiopia together. There is an annual conference which happens yearly, so it brings us together. This is what I understand about EPS.
Ethiopian Pediatric Society is a voluntary professional association bringing together pediatricians as well as all professionals who work on child care. It's a non-governmental organization.
The main accomplishment we feel is around newborn. That is to say that the newborn health in this country was totally forgotten agenda for many years. So since we started functioning as a society, we started with establishing NICUs in all over the countries. We started with 8 NICUs that now has reached to 250 NICUs in the country, and not only establishing NICUs but also capacity building of health workers on the care of newborn health, and that has improved a lot in quality of care for newborn babies. And beyond that, in child health also, we have been involved in training health workers on IMNCI, in ETAT, in nutrition, and EPI, and almost all child health issues and capacity building. We also are engaged ourselves in advising the ministry in policy and working groups. Many of us are sitting in the ministry as working groups, like EPI working groups, newborn working groups, and child survival working groups. So all this we feel our accomplishment during these 25 years. And we have also organ, which is Ethiopian Journal of Pediatric and Child Health, which has been published for the last almost 20 years, once at least in a year, and currently twice in a year. And we are conducting, professional development programs for our fellow members, in helping them acquiring CEUs, and that has satisfied many of our members.
I think the biggest accomplishment is bringing us all together so that we can share our experiences, because some of us work in more remote areas, some of us work in the tertiary hospital, so it brings the opportunity for us to share our experience, and also it also brings us friends together, and also some points from the seniors and the juniors share some ideas. So I think it's a good forum for us to learn.
Ethiopian Pediatric Society has been working with the Ministry of Health primarily, as well as with all other stakeholders that work on child health in the country. One of the areas is research to promote child care in Ethiopia, and Ethiopian Pediatric Society has been participating and contributing to that. The other main activity accomplishment is really helping Ministry of Health in guideline development, training materials, and in some cases even directly supporting training of health professionals on child health.
I would say, to my knowledge, their biggest accomplishment, I might not know if they had anything more, but their biggest, to my knowledge, would be their work on research and sharing of knowledge and passage of right, such that to the next generation.
One is to survive and to grow. From very few members, now we have gone to hundreds. That is one of the biggest achievements. The other is it has played a significant role in the health policies and all, in working in collaboration with the Ministry of Health, in particular in child health, and also publishing its journal, which is continuously now has become a journal which is now accepted by AAU, at least for the last few years, and that's one big achievement. The other, which I would say, is it has taken its international role, and it has played a significant role in international pediatric fora, like the International Pediatric Association, where EPS was represented in the standing committees, and also EPS was a member of the executive committee of the African Pediatric Association, which is called UNAPSA, and also now Pediatric Association, EPS is playing a key role in the development of postgraduate training in pediatrics for East and Central African countries, which is now has been established and launched, and it is playing an active role in that with its members. At least a group of us are there, and that is what is a big achievement in terms of that. The other is it has tried to play active role in the research and development in the country, and also in the training of manpower in pediatrics for its own professionals, its own members, and the other in supporting with other NGOs working in the area of pediatrics in the country.
The biggest accomplishment of the Ethiopian Pediatric Society is, I would say, its contribution to child survival, especially in the reduction of neonatal mortality.
Well, Ethiopian Pediatric Society has been really vocal in terms of policies and guidelines that are emanated from the Ministry of Health. We've been active in participating in sharing the opinion of most of the pediatricians and practicing doctors and nurses with regard to children's health in this country. So far, we have done really our best. Still more is really remaining to be accomplished.
Creating us a professional society by itself and coordinating professionals involving in pediatric and child health in the country as a whole is one of the biggest accomplishment for me.
That is it. The biggest challenge is, of course, is finance.
Okay.
If you have the money, you have everything. That is the major problem, because this is a society which is getting its money from its members, from other activities, and that's a major challenge, because the society has to pay a huge amount of money for its office rent, salaries, and for the staff and other office activities. So that's the biggest challenge for the Ethiopian Pediatric Society. If it has the money, then it would have grown very much. But that's the biggest challenge, I would say.
So I'm still young and second year resident, so I might not tell you to the full extent what their challenge was up to now, but I think what their challenge would be in the future is would be the reaching to their full potential, the reaching to the country, like countrywide. Hopefully they would make it countrywide instead of just here in Addis. For that, I think they would have to include all of us and share their goals and with us, with every pediatrician.
Well, the biggest challenge of EPS, the national challenge, the current situation that we are in, is also a challenge for the Ethiopian Pediatric Society.
Well, in Pediatric Society, the major problem we faced was really promotion and getting as many members as possible. We had also room for associate members, including nurses, public health specialists. And another major problem we had was finance. But during my tenure as president of Pediatric Society, Ethiopian Pediatric Society, we had managed really to prepare projects, develop projects, and work towards the capacity building of pediatricians, as well as also empowering our society.
I think the biggest challenge is with funding, because what I just said on research and other activities requires funding, and up to now the association, the society is dependent on member contributions and some external funding. I think that's one. The second thing is the society should be prepared for dealing with new emerging diseases. For example, the last time when COVID came, for child health, COVID in children was, it fell on the shoulders of the society to bring in experts on that. The other thing is there are things that in children in pediatrics that are emerging in terms of new diseases, and that the Ethiopian Pediatric Society should be prepared in terms of preparing its members to deal with those new problems.
We are looking forward for EPS to be one of the leading professional association caring for children in Ethiopia, in East Africa and beyond. So we are really very much working hard to accomplish this vision.
I wish the society be more influential in the making of child health policy, and to be more influential and improve child survival.
So what I wish for the Ethiopian Pediatric Society to accomplish in the future is, as I've said, to reach to every child. And I wish they could focus on child health as well, not just pediatrics. We get the sick child. The sick child comes to us, and as we know in our country, they come very late, especially from rural areas. And I wish that we can reach to them early, and also focus on the healthy child, because the future of the country depends on every children. But well-being clinics and child health growth and development should be area of focus, I feel.
Although I didn't tell you, I have also much interest in community pediatrics, and I'm now chairing a couple of boards that really look after children. One is an AFCAN that looks after child abuse and neglect. So I feel that in the future our society needs to go into the community and be vocal on children's issue, not only health but other social dimensions that we should look into. And we need to look into certain disabilities in children that are occurring. How should we really manage children with disabilities? How should our society could focus on that aspect? There are other problems, as you see, like blindness, deafness, other neurological problems like autism and others. So I feel that we have not done much on that area, and I feel in the future we need to be really multi-directional and be comprehensive as much as possible as far as children is concerned, not only on singular clinical health and public health, but we need to go further into the community's need as far as children is concerned. At least even if we are not really involved in managing them, at least we need to leverage support from different angles and manage children comprehensively.
So my suggestion would be, from the previous experiences that I have attended the annual conference, we have seen that usually the discussions more focuses a specific unit. So it would be nice for the society to consider more inclusive discussions, especially in regards to the teaching sessions.
In the future, I think EPS should strengthen itself to solve problems of the country, through its own members' contribution in research, and also increasing the capacity, the skills of its members in dealing with problems throughout the country, ensuring that inequities are addressed. And the current problem is access, and pediatricians, the numbers are so small that sick children do not get service from pediatricians all over the country. So that's access, even by other professionals like nurses and so on. That access needs to be increased, and with the Ministry of Health, the society should be working to ensure that child care is of quality, plus it has to cover the whole country.
Well, one of them that what I would wish is, as I said, is to be self-sustained in terms of finance. That is the key one. So we have to work hard towards getting a sustainable finance source to keep our society. The other is I would like to see our journal, the Ethiopian Journal of Pediatrics, now accepted by the AAU, but I would like it to see as an internationally recognized and accepted journal to appear in the World Fora. So I would expect that to happen. And the other addition is that I would like to see the Pediatric Society to play more active role in the policy decisions, guideline developments, in collaboration with, as I said, with the Ministry of Health and with other societies or organizations or agencies that are working in the area of pediatrics. I want that one because that's our primary aim of the society, is to improve and promote child health in the country. So we have to play a key role in that area. Yeah, that's the most important that I would say. The other thing is, as we have already good positions at the international level, we have to maintain and be visible and actively participate in the international fora like APA and the African Society of Pediatrics and other pediatrics related or child health related activities. That is an important area which I would expect, I would wish our society to play this significant role.